Welcome to the National Health Insurance Administration. This is an overview of Taiwan's National Health Insurance Program, which was launched on March 1, 1995, to provide health insurance for all Taiwan residents. Here's today's agenda. As of December 2025, Taiwan has a population of over 23 million, with 20% of individuals aged 65 and older, marking the country's entry into a super-age society. In 2024, Taiwan's GDP per capita reached $34,238, while national health expenditure represented 7.77% of the GDP in 2023. The life expectancy stands at 84.3 years for females and 77.4 years for males. Before the implementation of national health insurance, Taiwan had 13 separate social insurance programs that covered specific groups such as laborers, government employees, and farmers, offering benefits including health care and pensions. However, by 1994, only 59% of the population was insured. Since its establishment in 1995, our national health insurance has consolidated the health plans of the aforementioned insurance systems, providing nationwide health protection to Taiwan citizens and international residents. To further improve healthcare quality, ensure financial sustainability, and strengthen public participation, second-generation national health insurance was introduced on January 1, 2013. Taiwan's healthcare system is dominated by the private sector. Hospitals adopt the closed staff model, and physicians are primarily salaried by hospitals. There is no gatekeeper system to screen patients. Patients can go to any clinic or directly visit any hospital without a referral. The volume of hospital outpatient services is high as a consequence. However, healthcare is usually provided in a timely way, and waiting times are negligible. As of 2024, Taiwan had 2.4 physicians, 0.7 dentists, 0.3 Chinese medicine doctors, and 8.2 registered nurses per 1,000 population. Taiwan's national health insurance is a mandatory program covering all residents and is solely administered by the National Health Insurance Administration. Patients pay only small co-payments, while disadvantaged groups receive subsidies and waivers. Although healthcare provider participation is voluntary, 89.71% of providers nationwide have joined as of December 2025. They are reimbursed under a global budget system through various payment methods, ensuring both access to healthcare and financial sustainability. Taiwan's national health insurance has earned a strong reputation and is widely recognized as one of the country's most valued public programs. Public satisfaction has steadily increased since its launch. In 1995, the first year of implementation, satisfaction was only 39%. It rose quickly to 61% the following year and has continued to grow, reaching 81% in 2015 and 91.4% in 2025. It's worth noting that during the COVID-19 years, public satisfaction actually rose, never sinking below 90%. Taiwan's national health insurance provides a reliable healthcare network for all residents. It is internationally recognized for achieving universal health coverage and for offering comprehensive care at an affordable cost. Everyone can access healthcare services, regardless of their ability to pay. Public satisfaction remains high, and the quality of care continues to be consistently maintained. The national health insurance is mainly funded by premiums, which include both general and supplementary premiums. Everyone pays the general premium based on a set formula or fixed amount. Since 2013, a supplementary premium has also been levied, currently set at 2.11% on certain types of income, including large bonuses, professional fees, part-time wages, stock dividends, interest income, and rental income. There are 6 categories of insured, each with different ways of calculating premiums. Most salaried employees are in Category 1, paying 30%, while their employers cover 60%, and the government 10%. The government fully covers premiums for low-income households, military conscripts, and even inmates. Category 6 premiums are based on the average of Categories 1 to 3, with the government covering full premiums for veterans. Others in Category 6 pay 60% of the flat premium, approximately $27 per month. Premiums are primarily calculated based on regular salary income. However, in the first decade of this century, salary income declined as a share of national income, causing premium growth to lag behind overall income growth and leading to funding shortfalls. The introduction of a supplementary premium on various non-salary income sources has helped alleviate these long-standing financial challenges. An earmarked subsidy of $233 million from the government budget was allocated to the NHI Fund for 2024 and 2025, with further allocations planned for 2026. Meanwhile, the government is committed to contributing 36% of the NHI Fund. Our national health insurance provides comprehensive benefits that cover inpatient care, outpatient care, drugs, dental services, traditional Chinese medicine, daycare for the mentally ill, and home health care. Expensive health services, such as dialysis and organ transplants, are all covered. The insured must pay co-payments when they use medical services. The co-payment is partially waived in cases where the hospital outpatient visit is arranged through a referral, to ensure that people who really need health care do not lose access because of this cost-sharing mechanism. Individuals who meet certain conditions are exempt from making co-payments. The average utilization rate for national health insurance outpatient services in 2024 was 16.36 visits per person, including dental care and traditional Chinese medicine. For inpatient care, the average utilization rate was 14.87 admissions per 100 persons in the same year. This level of outpatient utilization is substantially higher than that observed in many OECD countries. Since the implementation of national health insurance, the contracted rate for medical institutions has consistently remained between 91% and 92% nationwide until 2024. All hospitals are contracted under the national health insurance, achieving a 100% contracting rate. Among clinics, dental clinics have the highest contracting rate at 98%. Since its inception, the National Health Insurance Administration has primarily reimbursed healthcare providers through a fee-for-service mechanism. To better contain healthcare expenditures, global budget payment systems were subsequently introduced, consisting of 5 sectoral global budgets for dental care, Chinese medicine, clinics, hospitals, and dialysis. In 2010, a Taiwanese version of diagnosis-related groups was implemented to further rationalize reimbursement for health services. Most recently, in 2025, the prospective Individual Hospital Global Budget Pilot Program was officially launched to support hospitals in managing costs more effectively. Taiwan is determined to reduce premature deaths from chronic diseases. Through the Healthy Taiwan policy, we set the 888 goals: 80% enrollment in care networks, 80% receiving lifestyle counseling, and 80% achieving metabolic control. To achieve these targets, the National Health Insurance Administration is leading key reforms, integrating chronic care programs, strengthening lifestyle interventions, and leveraging digital tools like My Health Bank and AI-powered services. These efforts demonstrate Taiwan's strong commitment to healthier people, stronger systems, and sustainable outcomes. Taiwan's national health insurance has been advancing healthcare services in remote areas. Since 1999, Taiwan's Integrated Delivery Service, IDS, has extended specialty care to mountainous regions and offshore islands, supported by designated hospitals. In 2021, telemedicine reimbursement was introduced, further improving access in remote areas. Today, with digital tools, IoT technology, and regional acute care networks, IDS is evolving into a holistic care model, ensuring that innovative and integrated healthcare reaches every community. Since August 2025, the NHIA has expanded telemedicine reimbursement to cover all specialties and extended its coverage to 135 townships, making it even more convenient for patients in remote areas to access healthcare services. We have established a provisional listing fund for cancer drugs outside the NHI global budget. In 2025, about $167 million from the government budget has been appropriated to create a dedicated provisional listing fund for new cancer drugs within the NHI fund, with a projected additional $167 million to be appropriated in 2026. This fund will act as a buffer for cancer drugs or new indications that address significant unmet medical needs and show therapeutic potential, but for which clinical benefits or financial impacts remain uncertain. One of the core values of Taiwan's NHI program is to remove financial barriers that would otherwise prevent people from getting needed health care. This explains why the NHI can cover catastrophic diseases, such as patients with hemophilia, who spend 76 times as much as the average patient. At the launch of our NHI, patients used paper cards, while providers submitted claims electronically. In 2004, a smart card was introduced, along with secure data transmission through a virtual private network, VPN. In 2013, PharmaCloud, later renamed MediCloud in 2016, allowed providers to securely share health records. My Health Bank was introduced in 2014, giving individuals easy access to their personal health data. Most recently, in 2024, an electronic prescription program was rolled out, and telemedicine coverage was also expanded, further improving healthcare accessibility for all patients. Patients have to present their NHI card when asking for NHI health services. The NHI card contains records of a patient's last 6 visits, drug prescriptions, drug allergies, catastrophic diseases, consent for organ donation, consent to palliative care, and consent to a DNR order. In recent years, cloud technology has been applied, and the NHI card features several new functions. Our digital NHI card is extensively utilized in home healthcare, telemedicine, and video consultations. The NHI MediCloud, initially launched as PharmaCloud in 2013, has evolved into a nationwide platform providing secure access to patient records and medical images. Access is authenticated through the patient's NHI card, the health professional's card, and the NHI Security Access module. By displaying medications, surgeries, allergies, and implants, MediCloud helps physicians make safer clinical decisions. With real-time alerts and robust data protection, it supports millions of inquiries monthly across Taiwan's NHI system. Since 2014, My Health Bank has empowered people in Taiwan to manage their health through a secure online platform, accessible on both mobile phones and computers. It allows users to check medical records, medications, tests, vaccinations, and even add their own health data. During the pandemic, it became essential for distributing masks, vaccines, and rapid test kits, helping safeguard the population. Today, 1 in every 2 Taiwanese uses My Health Bank. By integrating health data and linking with third-party apps, it enables risk assessment, disease tracking, and chronic care management. With AI, it will deliver even more personalized and proactive care in the future. Digital NHI cards became increasingly important during the COVID-19 pandemic. Linked with the NHI app's telemedicine interface, they allow healthcare providers to identify patients and access MediCloud records. To encourage adoption, the National Health Insurance Administration also helps healthcare professionals offer digital NHI card services without extra hardware to ease operational and financial burdens. The pilot electronic prescription platform streamlines how patients obtain their medications. Prescriptions are linked to a QR code available through the NHI app. At the pharmacy, patients simply present the QR code, which pharmacists scan to verify details, prevent duplicate dispensing, and ensure safe, accurate service. The system was first piloted at Hualien Tsuji Hospital in 2024 and gradually expanded nationwide in 2025. The National Health Insurance Administration has developed a primary care platform called the Family Physician Platform, using Taiwan's NHI database and integrating information from My Health Bank. The platform helps family doctors identify high-risk patients, predict health risks, and manage chronic conditions early, while also supporting preventive care. Information is shared securely with healthcare providers and patients, making healthcare more efficient, improving outcomes, and empowering people to take an active role in their health. Using diabetes as a case study, we illustrate how researchers leverage depersonalized health data to develop risk prediction models. Once risk levels are identified, AI-enabled health education can deliver personalized guidance tailored to individual needs. This approach supports healthcare providers in implementing customized management strategies, ensuring that care is closely aligned with each patient's specific needs. To facilitate patient-centered and valued healthcare, the NHIA will employ innovative transformations to enhance the NHI systems, focusing on digital transformation, service optimization, emerging technologies, and innovative models. In pursuit of health for all and sustainability, the NHIA is extending healthcare beyond hospital walls, proactively providing healthcare in communities and homes, and making it more equitable and accessible. To foster holistic care rather than mere healthcare, the NHIA is also encouraging preventive healthcare and facilitating the integration of long-term care. Furthermore, not only is quality healthcare emphasized, a value-oriented payment system is also being established to elevate healthcare. We welcome you to visit our website at www.nhi.gov.tw for updated information. Thank you for watching. We hope you enjoyed today's presentation.